Dr. Regina LaRocque, in the context of how I feel right this moment with the energy that Kathy and Tom have just brought in about what's going on in Chelmsford. Because I feel that we may be here in the United States on the cusp of turning an incredibly important corner toward not only relief from this horrific plague that we've all been suffering under, but also the horrific plague of climate change denial and obstruction and resistance. And Rick, you said a moment ago to Tom that you're on your way, and it's people like us at the grassroots level that are very, very important in making the change, and have unity coming our way from the top of the world's power structure, uniting with the kinds of things that people such as Tom and Kathy and all of us here are engaged with. I think we're moving toward the point of becoming an unstoppable force, and it brings my heart great joy to be able to say that because I've felt under an oppressive yoke of ignorance for a very, very long time. And one person who is definitely not under an oppressive yoke of ignorance is Dr. Regina LaRocque. And we came to know of Regina's work initially through an op-ed piece that she wrote criticizing the burning of biomass as a renewable fuel. And on looking into her website and other statements that Regina has made, we saw that Regina is very concerned about the impact of climate change on human health and the spread of infectious disease. Regina is an infectious disease expert. Regina is one of the founders and leaders of Climate Code Blue, whose website you can find. I'll put that in the chat. And this is a team of really great physicians. I think they're mostly associated with Partners Healthcare, but I might have that wrong. Regina, you can correct me. And Climate Code Blue is committed to amplifying the voices of children, underprivileged communities, and communities of color who are being harmed disproportionately by the pollution generated by fossil fuels. And among other activities, Climate Code View is seeking for universities and hospitals to divest themselves in their endowments and retirements funds from fossil fuels. Now, Regina's in the category of the type of person I've always felt a great deal of respect for, and I'm sure that others will feel the same. She has an MD from Duke University School of Medicine. She has a master's in public health from Harvard. She's on the staff at Mass General in the Division of Infectious Diseases, and she is an associate professor of medicine at the Harvard Medical School. Regina has authored more than 100 peer-reviewed publications and book chapters. And just parenthetically, as somebody who's, I think, offered maybe 3 or 4 of those, somebody who's offered 100, that really gets my attention. So congratulations on that front. And Regina is also a real boots on the ground person because she is an elected member of the Wellesley Natural Resources Commission. Regina is with us today to elaborate on the public health threats presented by climate change and to describe Climate Code Blue's activities in more detail. And after her presentation, she will respond to our questions and comments. And with that, I turn it over to you, Regina. Thank you again for joining us.
Wow, thank you, Michael, for such a nice introduction. I I'm honored to be here with all of you, and some of you I may have met over the years, and others I hope to meet. I think the work you all are doing is fantastic and so important. So thank you for inviting me to talk with you. So just logistically, Michael or Rick, are you going to allow me to share my screen, or how's that going to work?
I think you're
you should be able to,
co-hosted.
yeah, I made you a co-host. You should be, I think you should be able to share.
Okay.
Yeah.
So
Give it a shot.
how do I do that? Just say share screen?
Yep.
Yeah.
Okay. All right.
Looks like it's working.
Are you seeing my screen? Okay, I'm going to change it to this presentation mode. So I hope I can still see you guys. Okay, can you all still see me?
Yes.
Okay, I like to see some faces at least so I don't feel like I'm just talking to my computer. Well, so I've already been introduced. I'd like to, this is a little bit of what I'd like to talk with you all about today. It, again, is such an honor to be here. I could talk about this topic, frankly, without limit. And so I'm going to try to keep my comments, as brief as I can and allow us some time to have some conversation, I hope, afterwards. I do think as an infectious disease specialist, I'm keenly aware of the fact that anytime I'm in a room, people really only want to talk about COVID. So I'm open to any kind of questions you might have as this talk proceeds. But I'd like to tell you a little bit about my story, why I'm here, why I care about this topic as a physician. I'd like to give you my thoughts on why the climate crisis is really a public health crisis. I'll talk, mostly about the US. I'll talk a little more about infectious diseases because that's what I care about. And I want to talk about pollution and how that's really an important part of the narrative. And then I'd like to give you my thoughts on, what are the roles of physicians and other health professionals in this sphere. And I hope maybe that includes some of you all as well. I like to start out, since I'm a scientist at heart, giving you my references. And I hope these are references that you all are already familiar with. But if you don't know about the Lancet Countdown on Health and Climate Change, I really refer all of you to this as an excellent resource for learning about what's going on in the human health sphere related to climate change. For a number of years now, this is an annual summary of data that is being followed by dozens of professionals as a marker for how we're doing. And they just had their 2020 release a couple of days ago. And there actually is a US policy brief that accompanies it that is also excellent and focuses on the health concerns specific to the United States. So I want to refer all of you to this as a resource. I'll just point out that we also now in the medical world are more and more talking about these concerns, and the New England Journal of Medicine has a fantastic interactive web page on climate and health. And I don't know if you're familiar with the Medical Society Consortium, but frankly now dozens of medical societies have come together to make public statements on climate and health. And these are all coordinated through the Medical Society Consortium. So I refer you to all of these excellent sources of more information. So I just want to tell you about myself. So I'm a specialist in infectious diseases. I've been practicing for 20 plus years. I'm fundamentally a researcher. I trained really in the field of diarrhea and microbiology, and I spent many years studying cholera. And I, in the course of that work, have worked overseas in Bangladesh and Haiti. And frankly, anybody who studies cholera understands that the environment in which people live is really the fundamental determinant of their health. Cholera is seasonal. It comes with the rains. And everybody who lives in the region of the Bay of Bengal that is home to cholera understands this association. And frankly, what drew me to the field of infectious diseases was a desire really fundamentally to address the diseases of the most vulnerable in our society. And as I spent my training years learning more about infectious diseases, it really was hard to remove myself from the the fact that our social structures really are what determine the health of our populations. And I watched as the years went by and the data became more apparent to me about what was going on with our climate, that really was fundamentally a bigger threat even to my patients than anything I was working on in the lab. But I wasn't really sure how to incorporate it into my own activities. And frankly, what began to change for me was having kids. And those are my kids in the bottom right corner. You know, I think probably similar to what has drawn all of you to this work, you know, I'm concerned about the world that we are leaving to our kids. So about 5 years ago, I decided that maybe I should begin to get involved in my own community as the place where I have really the most possibility of influencing. So I live in Wellesley. And my journey to getting concerned about climate started by just showing up at a meeting of Sustainable Wellesley. And I've come a long way from there. It led me to run for office in my town. I'm a member of town meeting. I served for 3 years on our Natural Resources Commission. My term is up. So I've learned a lot about kind of how things work and how you can advocate for change in your own world. So that's me. It led me to begin to talk about this topic in my own professional sphere. And I think there really has been more and more attention to this in the world of medicine over the last couple of years than I've ever seen. And at this point, it's not really debatable that climate change is a health crisis. But frankly, when I wrote this piece now a year and a half ago with my friend Karen Solomon in the New England Journal, it kind of felt like we needed to draw people's attention to this. But we've come a long way. I really think that you can see from here in the bottom right, nearly every medical professional society at this point has made a declaration that climate change is a health emergency. So I think that there is general consensus around this now. So I'd like to talk to you a little bit about why climate change is a health concern. So I think this group fully understands what it is that's going on with the climate. But I think that a few things I just want to emphasize are the complexity of the problem, you know, which is the fact that the factors that are at play are really fundamental to how our society operates, how we run our homes, how we feed ourselves. Greenhouse gas emissions are interdigitated into all of our daily activities. And so this is really a question of societal transformation. It's just a fact. The other fact is that I think now to many people, we can see with our own eyes what is going on. And it is, for me, important to name that, because for so long, I think, you know, we have all understood that as human beings, we have a hard time dealing with threats that are invisible to us, that we can't see with our own eyes. And so I really like to remind myself, and when I talk to other people, remind them that climate change is actually visible to us. We can experience it, but we have to recognize it. And so, you know, rising sea levels, warm temperatures, you know, it's remarkable. At this point, we all feel every year it is a record-breaking season of heat, and that is undeniable. It is happening. We know that sea and land ice are disappearing. The data from just last month, the second lowest total ice extent in the Arctic in observed records. And I refer you to some of the really incredible visualization tools that are out there now that allow people to kind of see what's going on. You know, this is a picture of a disappearing glacier. So seeing is believing. This is happening right here in Boston. I think we all need to appreciate the fact that we live in a coastal city. And I like to show this picture because you just have to look at it to understand, like, Boston is a coastal city. And frankly, we lived through this with Hurricane Sandy, where we had something like a 5-foot storm surge. And we all remember the amount of water that was in the seaport at that time. And frankly, we dodged a bullet Because if Hurricane Sandy, which is certainly a climate-related event, had occurred at high tide, we would have had this kind of storm surge. And this is what Boston would have looked like. So, you know, this is our home community. This is, you know, my hospital right in the middle here. I think we also are all keenly aware that extreme weather events are now happening at an unprecedented pace. 2019 was the second wettest year on record, and that is what we experience in Massachusetts a lot, rain and wet. We've had weather-related disasters. We've had wildfires with the number of days that people are exposed to high wildfire risk increasing at remarkable pace over the last few years. And I think even though we may not see it so much with our own eyes, I do also keenly myself feel what we are losing in our insect and animal populations, in the bleaching of coral reefs. So it's all happening before our eyes. And then if we dig a little deeper, it's also happening in the way our world is behaving to itself. And I think we've all heard the conversation that climate change is a national security risk. And of course, that is great to know that we're finally talking about that. But there actually have been analyses, scientific papers. This is a paper from the Proceedings of the National Academy of Science that looked at the association between climate change and drought in Syria. And really, you can contend that a lot of what's going on in that part of the world right now, the conflict, is directly related to climate. Food insecurity, water scarcity, these are fundamentally issues that affect how our nations interact, and they are directly related to climate. We know that crop yields and availability of water resources to urban areas are currently being affected by climate. And these are fundamental issues of human health and security. So, you know, the narrative for me has been, over the years of my time talking about this, you know, having to begin with getting people to buy into the idea that this is a public health concern. And so I am pleased to see that there's been so much progress in the area, but I just want to point out that I feel like part of the problem has been that it's the parable of the elephant, which you guys have probably all heard of, perhaps an Indian story, that we're all kind of approaching the same issue from a different perspective, and we feel it. And to us, it's one thing, and to somebody else, it's something else. But stepping back to see that we're all kind of touching the elephant from different sides, I find it to be a very relevant narrative for how climate affects health, because it affects it across such a broad array of sectors that unless you step back and see the whole picture, you might miss what's actually going on. So I'd like to tell you a little bit about what the fundamental areas where climate change is affecting health. And I'd like you to have these concepts in your toolkit when you go and talk to your climate council in Chelmsford, or when you talk with your legislator about why this is a health concern. So, you know, number one, and probably number one for us in the US, is heat-related disorders. So we know that summers are hotter, the hottest days are hotter, and the amount of time that people spend being exposed to heat is increasing. And heat has fundamental effects on the human body. I think we've all experienced extreme heat occasionally, but for people who don't have access to cooling or who spend prolonged periods of time in the heat, this is a profound health risk. People get exhausted, they get chronic kidney disease. There's actually a newly described form of kidney disease in people who work outside under heat conditions. In 2019, over 102 million more days of person days of heat wave exposure in the US compared to 10 or 15 years ago. People are not able to work when they're hot also, so there are hours of labor lost. So heat-related disorders are a big concern. I I think we may all remember 2003, the heat wave that crossed Europe, where temperatures were over 104 degrees in Paris and other cities. And remarkably, 75,000 deaths were associated with that series of events. And so this is a figure from the Lancet countdown that I just alluded to before, showing heat-related deaths globally, and you can see this kind of steady rise. Another area of concern is allergies and asthma. And I just want to point out how important asthma is as a concern, health concern in Massachusetts. I don't know if all of us know the dubious honor that Springfield, Massachusetts is the asthma capital of the United States. Among children in Massachusetts, asthma exacerbations are among the most important health concerns, the leading cause for days of school lost. And so what we have seen is that there has been a prolongation of the allergy season and the associated asthma exacerbations that go with it. So what you see here on the bottom left is ragweed production, which has been steadily rising in association with atmospheric carbon dioxide. And this obviously relates to how plants biology works. So we have seen a lengthening of a pollen season and increasing amounts of allergies and asthma associated with that. Mental health disorders, I think, are something that are another kind of important concern related to climate. We certainly know well that people who experience extreme weather events, who are displaced or relocated or have financial loss from disasters, have profound mental health repercussions. You know, at this point, the amount of study that has been done of the people who were displaced by Hurricane Katrina, we know that these health and mental health implications are long lasting for people who've been through that kind of trauma. So certainly the occurrence of extreme weather events provokes a lot of mental health distress. There's a lot of interesting association between heat and mental illness. When it's hot outside, there are more deaths and murders. And so this is kind of a complex interaction, but something we need to be aware of. We know that the medications that people take for psychiatric illness impairs your ability to handle thermoregulation. So that's another factor. And then frankly, I think we all should just name the issue that our children today are anxious about this. And that is not to be dismissed as a concern. So I'm an infectious disease specialist, and I'll take a minute to dive a little bit deeper into that sphere and tell you why, for me, this is clearly a concern. I have to share with you, had to really press the case on this for a couple of years, but I've been proud to see my own infectious disease society now come out very comfortably and publicly saying that these changes in infectious disease dynamics that we're seeing in the world, we should be concerned that they're associated with a changing climate. I think from my perspective, I know that microorganisms that cause human diseases exist as part of ecological systems. So it, of course, is no stretch for me to believe and understand that changes in our climate, disruptions to ecological systems, are associated with human disease. And I'm showing you here just a couple of examples that you may be familiar with: the tick that causes Lyme disease and other tick-borne illnesses, Coccidioides immitis, which is a fungal organism that exists in desert areas, causes valley fever and has been rising in recent years. And of course, mosquito-borne illnesses, which has been one of the kind of key topics in this area for some time. So almost every organism that causes human infection exists in the environment in some level. And so, of course, these things are related. This is just to emphasize the point that, all of the things I've told you about already: precipitation, flooding, and drought, movement of human populations, either forced or through refugee crises, changing temperatures. These are things that affect infectious diseases in human populations. And these are the very things that I've just told you are occurring in more frequent episodes because of climate. So it's fascinating to me that we already knew that weather systems affected infectious diseases. We've been observing this for decades. As I mentioned, work in the field of cholera, and it's actually well known that some of these El Nino oscillations that are weather patterns across large ocean areas are specifically associated with outbreaks of human infections at different places around the world. So for instance, in the 1990s, I'm showing you a headline from that time, cholera appeared in South America unexpectedly, and led to hundreds of thousands of cases and deaths. And all of this was directly related to weather patterns in the oceans. And we actually have been able, in this paper that I'm referencing here, using models from just one component of the weather cycle, we can predict when outbreaks of infection are going to occur. So this is not a shock to those of us who work in this area. So what are the manifestations that we're seeing of changing climate and changing infectious disease patterns around the world? Well, mosquito-borne disease is one that we talk about a lot. So this mosquito here, Aedes aegypti, is a particularly bad actor in the sense that it likes to live in cities, it likes to bite during the day, it breeds in water that is stagnant. But as you can see from the map here, in red, the progressive kind of areas of the world that have been affected by dengue over decades. So we have seen now in recent years the highest number of dengue cases ever. It's exploding. It is present in all of South America in huge numbers. And of course, as I mentioned about the elephant, there's many factors at play here. They are complex in their interreactions with each other. More people living in cities, behaviors of humans in cities. But I would contend that changing climate, changing ability of this insect to live in certain regions is a big part of it. As I mentioned, my own kind of organism of interest, Vibrio cholera, we have seen with warming ocean temperatures, which is what you're seeing here with the red and yellow areas, that these Vibrio organisms are able to survive in different parts of the ocean and more coastal areas along the United States. And we are in fact now seeing more Vibrio infections in the coastal areas of the United States than we have ever seen before. Not cholera, but organisms that are related to cholera that cause other types of infections. I mentioned to you about valley fever. This is a fungal organism that is present in California, and that tends to spread in areas suffering drought. And you see here the CDC data on reported cases of coccidioidomycosis over the last couple of decades. There's been a steady rise in the areas of California that have been suffering drought. And then insect-borne disease, particularly tick-borne illness, is something that we talk about a lot here in Massachusetts. And the numbers of reported tick-borne illnesses in the US have doubled and tripled over the last couple of years. So of course, there are many factors at play. We are diagnosing these more frequently, but we are also seeing that the range where the ticks can live, as I'm showing you in the kind of upper right area, has expanded. So we see more tick-borne illness in more unusual locations. And we're also seeing a broader range of types of tick-borne illnesses. So over the last 5 to 10 years, 9 new tick-borne illnesses have been described in humans. In the bottom right is a case that I was involved with presenting at MGH, which was a 70-year-old woman with encephalitis caused by a virus called Powassan virus, which has really only emerged in humans in the last couple of years. So we're seeing more geographic range, a wider diversity of pathogens. And again, I would contend that climate is part of the issue here. Another area that I study is antimicrobial resistance in bacteria. And there's some very fascinating data emerging in the scientific world about this, and I just want to allude to it. So, I mean, in the upper right, you see here the CDC report on antibiotic resistance, which is really a global health threat. So bacteria that we cannot treat with antibiotics that are widely available. And frankly, there is a fascinating association between temperature and antimicrobial resistance. This is a paper that was published in Nature Climate Change a couple of years ago and has been substantiated with some other observational data. But just to give you the sense that the map on the left shows the distribution of issues related to antibiotic resistance, and the map on the right shows you temperature. So if you overlay these two things, they seem to be associated. I liked this concept that Tom Frieden presented a couple of years ago about the kind of hierarchy of public health issues. And I would like to just make the point here that I think this same hierarchy exists when we think about climate change. So, you know, at the top of the pyramid are the things that the individual can do to affect their health, right? Counseling, education, these are things that we talk about a lot in our individual patient encounters. But really, that's a small piece of the puzzle. The thing that really determines a person's health is the bottom of the triangle, right? The socioeconomic factors, the structures within which a person lives. And I feel it's important for us to understand that the changing climate fits into that bottom part of the hierarchy of health. So these are components of our lived existence that have huge impact on us in terms of our health, and that are structural. So the same model exists for climate, I think. So I'm going to pivot a little bit, and I just want to raise the issue of pollution, because for many years, for those of us who have been physicians trying to talk about why climate change is a health issue, it's been a struggle for people to connect the dots, I think, around the areas that I just presented to you before, but very easy for people to connect the dots between pollution and human health, because I think conceptually we already understand that pollution is harmful to health. And frankly, pollution goes hand in hand with the same chemicals that are affecting the climate, right? So burning fossil fuels emits carbon dioxide, but it also emits a ton of other chemicals and substances that have immediate effects on human health, right? So I'm listing some of them here. You know about benzene and metals like mercury or arsenic, particulate matter. And we can see these with our own eyes. You know, look at the picture of the children crossing the street. So, you know, we understand that smoke billowing into the air or exhaust coming from a car, that seems threatening to us because we can see it. So I have worked very hard in my speaking to make this link for people. And I just want to tell you a little bit about pollution and why it's such an important health concern. So, you know, I don't know how many of you out there might be health professionals, but to be honest with you, I continue to be gobsmacked by the fact that we don't talk about this enough as doctors, about how profound the effect on human health of pollutants is. We don't study it in medical school, and we don't talk about it enough, I think, in our daily practice, because the pollutants that we are exposing ourselves to have many effects on organ systems. They affect pregnant women, they affect human development during critical periods, they affect children. And my good friend, Phil Landrigan, who is local here in Boston, and very lucky of us to have him here, was a lead author on this Lancet Commission on Pollution and Health that has been coming out now for the last few years. And the number of premature deaths associated with exposure to pollution dwarfs everything that I've worked on in my world of infectious diseases, 3 times more than AIDS, tuberculosis, and malaria combined. So this is a really important human health issue. And I just add this in to remind us all to recognize the fact that exposure to pollution, including importantly in our country, is not equal between communities. And we know this in Massachusetts, right? This is Cancer Alley in the Mississippi River Delta, where you see that major industrial sites are predominantly sited in poor Black or brown communities. So there is tremendous overlap between the communities of color and the communities that are exposed to pollution, and this is the story of our country. So what are the pollutants that we should be thinking about the most? Well, particulate matter, I just want to emphasize as a really important fossil fuel related pollutant. So fundamentally what particulate matter is soot. I think we all understand when you burn fire, there's soot. Particulate matter is just really, 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 really small pieces of soot. And this is a picture that shows a human hair and a piece of sand. And then you get a sense of when we say PM10 and PM2.5, how small these little pieces of particulate matter are. They're invisible, but they are linked to an incredible range of human disease across many organ systems, not just the lung, but frankly, the brain, the bloodstream, and as we learned during COVID, infectious diseases as well. Higher levels exposure to these particulate matter is associated with higher rates of COVID. Children are especially vulnerable to particulate matter pollution because they're closer to exhaust pipes from cars. The other pollutant I will highlight is ground level ozone. And again, maybe you guys know about all this, but I think it's really important to remember that to 2 different types of ozone. There's the desirable ozone in the atmosphere, which filters out ultraviolet light, but there's this ground level ozone, which is a very potent irritant to the respiratory tract. And it's basically smog. And it results when nitrogen oxides from burning fossil fuel combines with light and heat to form ozone. And so deaths in the United States related to particulate matter are not trivial. So this is from the US policy brief that I was just mentioning, and it's showing you the estimate of the number of deaths, premature deaths related to air pollution in the US in 2018, and it's 68,000 in total, divided up by kind of the different sources of particulate matter. This is a study from the New England Journal, which I just like to highlight because it's so amazing to me. And what you're seeing here is a map of concentrations of PM2.5, with the red levels being the areas that have the highest concentration. And similarly, on the lower left, you see that the red areas have the highest concentrations of ozone that I mentioned. And what you see on the right is a relationship between death and the levels of particulate matter or ozone in those regions of the US across a huge population of Americans. It's basically all Medicare recipients in the US. And what you see is the classic dose response curve, which is the more of it you get exposed to, the more people die. And that exists both for ozone and for PM2.5. And what I show you in the yellow arrow are the current regulatory thresholds for those pollutants, what you are kind of deemed to be safely exposed to. And I think you don't have to be a scientist to see that there really is no safe level of exposure to either of these, because that relationship exists even beyond or below the regulatory accepted level. I'm going to not I'm going to leave us some time to talk, but I just want to say there's many examples where we've seen that controlling pollution makes people healthier. You know, that the Atlanta Olympics, when they stopped with the traffic, they had less asthma. If you put in easy passes instead of toll booths, you can make pregnancy outcomes better for people who live next to highways. If you take lead out of gas, you can make people smarter. So, you know, acting on pollution actually has tremendous immediate human health benefits. And the interesting thing is it actually doesn't cost our economy anything, because what you see here in the yellow line is that even as we decrease emissions and pollution, we still manage to increase our GDP over the last 40 to 50 years. So the argument that it costs too much to make the environment less polluted is really not true. And I like people to understand a little bit too about what air pollution monitoring really looks like. So this is a map that shows you the EPA sites that monitor pollutants in Massachusetts. They're shown in green, and they're pretty sparsely spread out. So it's good. It's worth acknowledging that we don't really have great data from a community level on how much air pollution we're all getting exposed to. So I just want to pivot a minute and just talk to you about the role of physicians. I think I'll skip my last two slides. So why should doctors be talking about this? Well, I hope I've convinced you that it makes sense. I do think that what doctors have to add to this conversation is not just bringing it down to a health level, but I do think that one of the things that we try to pride ourselves on is helping people understand risk and talk about risk. You know, we do this in our day-to-day conversations, but, you know, as a society, we need to have conversation about what this risk is and how we mitigate it. And I want to refer you to this also great resource if you don't know it. You know, George Mason University has been doing these polls on the 6 Americas and how people feel about climate change and how they understand it as a risk, with the group going from the alarmed group, which probably includes everybody in this room, down to the dismissive. And so it's a great place to kind of think about where the American public is on this issue. And I think the good news is that more and more people have moved into the cautious and concerned category and out of the doubtful and disengaged. And I think, as we know from most social movements, you really only need about 3% of people to be in the alarmed category in order to get some action. And one of the reasons I think why people have been able to move along this continuum is that Americans have begun to understand that these are risks to their health, to their own personal health. So these are data from April 2020 compared to October of 2014. And you can just see that more people understand that climate change is affecting their health in many ways. And so this is an important part of moving the public conversation on the topic. So there's many opportunities to talk to people about why doing all of these things is actually beneficial. You know, switching to clean energy and renewable sources of electricity improves the air we breathe. It makes us healthier. Reducing meat consumption also is better for you. It is better for the environment. Making our buildings healthier, you know, in all the ways that we need to do to improve their efficiency are also potentially better for our own health. Walking instead of driving a car, all of this good for your health. So there's really just profound co-benefits. And the other piece that I think has been happening in recent years that I'm really kind of happy to begin seeing is that the healthcare sector is beginning to understand that we ourselves are part of the problem. So this is kind of a complicated graph, but I mean, it basically shows you that the US healthcare sector is a pretty important emitter of greenhouse gases in and of itself. And so we need to begin to do some work on our own garden, so to speak, especially as you plot the amount of emissions versus the amount of return we get on those. So I'd like to just maybe end by telling you a little bit about our group, because I think that was the reason for being invited. But I welcome the opportunity to interact with all of you in our shared work together here in Massachusetts. So, we are a group of 10 to 15 physician activists who have come together and found community locally. And although we've all kind of separately been active in different spheres for some time, and we're eager to collaborate with groups like you guys on getting this message out. We really fundamentally find our mission to be raising up the people who are on the front line of these concerns. So we at Climate Code Blue have done a lot of work with the Better Future Project and CREW, I think you know about. We've been working with the Codman Square Neighborhood Development Center, trying to support affected communities. Many of us are academics, so we've been very involved in the divestment movement at Harvard and other local institutions. We want to advocate for the recovery from COVID to be green and just, and I know you guys were just talking about that. And as a group, we've done a lot of work talking about the health benefits of building electrification and natural gas cooking. So these are kind of the things we've been doing. I will share this picture with you, which I think is, and that's me on the steps of the State House. We've been very active, many of us, in raising concerns about the compressor station in Weymouth. And for those of you who are aware, it's really the single greatest climate issue in the state, and it is a health travesty. And it is happening already. They fired it up. But we've been working hard for a long time to raise the health voice as a real concern for this project. And this was us trying to deliver our petition of 1,200 signatures to Governor Baker in November of 2019. So I will conclude by saying that I hope we all agree that damage to the climate is real and it is happening now. It's a threat to the health of the planet, but it's also a threat to all of us. But working together, we can really achieve a healthier world for all of us by dealing with these problems. And I love this comic strip because, even if it's not about the climate, it's really fundamentally about things that are good for all of us. So I'll stop, and thank you so much for inviting me to speak with your group. And I'm eager to talk with you and hopefully engage with the work that you guys are doing going forward as well. I will stop sharing my screen.
Thank you so much, Regina. Wow, what a great talk and overview. So we have about 10 or 15 minutes, I think, here, Rick, for Regina to take questions and listen to comments. Shall we get that underway? Okay, terrific. So who would like to ask questions to Regina? Seth, go ahead.
Regina, there was something in the news last week, I couldn't quite track it down, about a report, I think it might have been from Lancet, about the number of deaths that were attributable to climate change. And I'm wondering if you could just comment on that.
Yeah, I think that that's the report that I was referring to you to. So the Lancet Commission on Climate and Health. And I would suggest anybody go to their website and spend some time perusing it, because it is really a comprehensive multinational effort to put our fingers on what are the health concerns related to climate change. How do you parameterize those, and how do you follow them prospectively so you know if you are heading in the right direction or not? So all of this has been spearheaded by the Lancet, which is a British medical journal, and I would contend that they have been really at the forefront of talking about this topic, and I applaud them for that. I think our own New England Journal of Medicine has really been picking up the picking up this topic too recently, and I'm glad of that. But the Lancet is light years ahead of us in terms of spearheading the data on this area, and that is what was in the news. The U.S. policy brief is put together by the American Public Health Association, and they try to distill some of that information and direct it at the U.S., and they associate it with specific policy recommendations as well. And literally that just came out December 3rd. So those are great resources for talking about health and climate.
Great, thank you.
Who's next? Arnie.
Yeah, thanks. And Michael, just one of the things I've run across recently, and I see Lana's done it and I did it. People are putting the word stack in the chat to indicate that they, would like to ask a question. I know we haven't done that before, but in other meetings, I've been doing it. So I suggest maybe we can start, using that technique. Anyway, the question I have, and that was a terrific presentation, thank you. A few months ago, I was just Googling about transportation and pollution, and I think I came across the EPA website, and they were patting themselves on the back about the dramatic reduction in pollution since the 70s. I forget exactly what pollutants, but it was, they were talking about a 99% reduction in this. And has there been an improvement in pollution in the transportation sector, or are they just blowing smoke at us? That's, I guess, my question. Forgive the metaphor. So
yeah, no, I mean it's a good point. So I mean the answer is yes. I mean I think we all know that even from your own lived experience, the smog over Los Angeles that existed in the 70s and 80s, a lot of that is gone. So there has been tremendous progress in the US in cleaning up air pollution for sure. I think that the issue is that there's still a lot more work that can be done, and I think the EPA over the last 4 years, it's fair to say, has been really gutted in terms of its regulatory strength. And a lot of it has centered on this issue of air pollutants. I mean, there's tremendous health evidence to suggest that we need to lower the levels of exposure to particulate matter that we find acceptable. But there's just been this kind of obfuscation going on about how you can use the data and the need for there to be transparency, when in fact the real goal is just to exclude large swaths of health data from their purview. And so I guess the answer is yes, there's been huge progress, but also yes, we need more. And I think one of the things that probably happened was that there was an attempt to tie carbon dioxide reductions to the Clean Power Plan as a technique for getting some traction on progress. And I wonder if that backfired a little bit. So I'm not a policy expert, but I think that that's going to be a fascinating conversation for this incoming administration. What is the lever that we pull to achieve carbon reduction? It didn't work as planned to do an executive order that it needed to be tied to the Clean Air Act. So, I mean, there's a lot of work to be done.
Lana is next in the stack. Lana?
Lana?
Yep, unmute.
You're,
Yep, I was muted. Sorry about that, folks. Dr. LaRocque, thank you so much. I mean, it's just an incredible presentation. And I guess the irony for me is that we know that from information about how to communicate the dangers of climate change, health is very effective. and also some of our most trusted speakers on the issue are health professionals and scientists. So it's kind of ironic to me that it's been slow to move within the physicians community. So thank you for your work on this. My question.
No, I'd like, can I respond? Because it's a really great point, Lana, and I appreciate you raising it. And I want to share, you know, just for me, it's been a journey of feeling comfortable giving a talk like this. And I think that you are absolutely right that it's the same with any health issue, COVID, vaccines, you know, hearing trusted individuals from your own community speaking on the topic is really the way to communicate, right? That's just public health 101. You know, but I think from what I've seen is that, you know, those of us who are scientists, there's a certain threshold of association or proof that you kind of want to see before you put your name on something or you put yourself forward as making a statement. And I feel to some degree like that has worked to our detriment over the years, because many people have been hesitant to say, well, you don't really know exactly, you know, if X effect is being caused by Y element in the climate. And that relates to, number one, we haven't studied it as well as we should have. Number two, these are complex biological systems. And so these are not linear associations, and that makes talking about it that much more difficult. And then number three, there has been a concerted effort by fossil fuel interests to confuse people about this, including, frankly, successfully, even people like in my own world, because when you can't fight the truth of the science, well, one way to get people is to just confuse them about what we know and what we don't know, and to cast doubt on things that really are not doubtful. And that has been a tactic for, you know, people supported by the fossil fuel industry to get the public to think that this is a doubtful area of science. I mean, it is not. This is confirmed, observed changes in the natural environment that is happening, and 99% of qualified scientists know this. So again, I think those are kind of the components of what's happening in the world that contribute to that general sense.
Merchants
For your question.
Well, I actually didn't even get to my question yet. But this topic could be an entire presentation. So I want to thank you. But Naomi Oreskes and Eric Holloway I don't think I got his last name correct, but they addressed that issue of that confidence level that scientists require, and how it's held people back, as well as the sowing of doubt, which was done, you know, in the tobacco fight and this one. So it's a serious matter, I guess. Well, okay, so my question had to do with policy, actually. I don't know if you're familiar with the TREC report that came out fairly recently. I'd be happy to send you a link, but you can find it on the Harvard Chan site. And it's basically what they were looking at was policy around, you know, I just realized I may want to have a different conversation with you. I don't want to take up, this is getting into a wonky area. I don't want to take up time on this. I appreciate your comments about the factors that have sort of held us back.
I put my email into the chat. Feel free to reach out to me.
Thank you.
And just want to say that Regina, Lana is one of the leaders of the League of Women Voters. And so it's a delight for us to make a connection between the two of you.
I just want to share with you, I'm a member of the Wellesley League of Women Voters. I mean, they're fantastic. And League of Women Voters has been out front in endorsing all of the right policies. So thank you.
Well, interesting you use the word out front, because the next question comes from BJ Batts, who is one of the leaders of Mothers Out Front. And I am mindful, Rick, and others of our time frame. I know we have other things to discuss here, so maybe, I mean, we've got a lot of great questions lined up here from a lot of terrific people. So maybe we can try to do another 5-7 minutes, Rick. What do you think?
Sure.
Okay, great. Okay, BJ, you want to go ahead?
Sure, thank you. Thank you for your talk. My question has to do with Weymouth. One of the big concerns of the legislative priorities of Mothers Out Front is how do we define EJ communities so that something like Weymouth cannot be built in their homes? And we are pushing an EJ amendment, which we hope will become a part of the climate law, but we don't know if it will. And yet there's some feeling that even if we do push this amendment and make it law, it still will not prevent things like Weymouth from happening, or even the biomass out in Springfield from happening. So I'm wondering if you have any suggestions of what kind of definition we need to develop that will really protect these communities that are already so overloaded with pollution.
Wow, I mean, that's a tough one, I guess. Well, so I will just share with you, and so before I was involved with Climate Code Blue, I was a board member of Greater Boston Physicians for Social Responsibility. And please take a look at the website where we have 4 comprehensive scientific reports that we wrote on the Weymouth compressor station. And I actually understand that in the Boston Globe on Sunday, the Spotlight journalist Mike Stanton's piece is finally going to be published that is going to raise the issues around all of the regulatory and public health issues that did not get dealt with on that. So get ready for that on Sunday. Hopefully it will be in the paper. I mean, I think, I don't know what BJ, what the answer is. I'd be happy to talk with you more offline. I mean, the bottom line is we need some kind of policy. Like, it is a travesty that in Massachusetts, we don't even have a definition on the law of an environmental justice community. And it is a travesty that those communities were burdened with this. And it is frankly because of Charlie Baker. I just think that we had an executive order with Deval Patrick around the definition. We had a movement towards a statutory ability to use that definition in making decisions, and then nothing happened in this administration. So from my perspective, we need to get moving. And yeah, that's all I have to say on it. It is systemic. It is the systemic reason for the inequities and exposures to pollutants that we have in Massachusetts, and it needs a systemic solution.
And I also think now is a good time because people are very aware of that in a way that they weren't even a few years ago. So I'm hopeful.
I mean, I agree with you. Like, to me, we have all been awakened as a society to what the inequities that are structural are, and we are living it now. And if we can't use this moment to change the way we have structured our environmental protections and our health system, if we can't pivot from this moment to something better, I don't know when we will. So I think now is the time to raise all of that up. And thank you for what Mothers Out Front is doing.
I think next up is Alan.
Okay, thank you for this, Regina. I wanted to talk a little bit about PM 2.5. I'm so glad you brought that topic up. It's a topic that's near and dear to my heart. When I worked many years ago in the Mass AG's office, I actually litigated a case against the Reagan administration when it failed in its 5-year review of the PM 2.5 levels. It's required every 5 years to do that review. When it failed to reduce the level from 20 to 15, just yesterday, or I think yesterday, EPA declined during the current 5-year review to reduce the level of 2.5 from 12 to 10. Andrew Wheeler announced that. And that simple reduction from 12 to 10 could have reduced air pollution deaths in the United States by 15%. And let me get this to a question. The the problem with PM 2.5 is it, in terms of enforcing whatever the limit is, it's not so hard to do it at industrial facilities, but much of it comes from our vehicles. And it's very difficult to reduce the levels. In fact, I think a lot of it comes from tires. And I remember a series of articles that were, I think, in the Globe a year or so ago, showing somebody had gone out along the busy traffic arteries in Boston, showing it within about, I want to say 200 yards of every one of those traffic arteries, the levels of 2.5 were exceedingly high. And I happen to have a granddaughter in a daycare center in Dedham along one of those routes. And so I've been struggling to figure out ways to do that enforcement. We really need to do something for health reasons along all those traffic arteries, which extend beyond EJ communities into, normal communities. So I don't know if you have any thoughts about that, but I saw on the logo you put up for the Climate Code Blue that you support electrification of buildings. Do you also support banning internal combustion engines in vehicles? And if so, by what date?
Well, I mean, I'm just going to laugh because I can support a lot of things, but it doesn't mean that anything's actually going to happen on it. But I mean, I think what you're saying is absolutely true. You're right. I mean, we've known all of that for a long time. That study I alluded to from the Atlanta Olympics, we knew back then that you could make people healthier by reducing traffic, right? And we know that the artery along the Mass Pike is a huge health concern. So, I mean, I guess I'll just say it's a little unfair, but I think I have in my lane, what can I do to help as a physician and a scientist? Well, I think the things that we can do to help are to make people understand that it's a health concern for everybody, not just EJ communities. So tying these health issues to communities like mine and Wellesley matters politically. I think we can continue to speak clearly about what the scientific data show and what it means for people's health. And then advocating for policy, right? But I'm not a policymaker. I'm a scientist, I'm a doctor. And so but I think more of us speaking on these topics and saying these things publicly, it moves us in the direction of, I mean, as a society, you have to decide, how much money you're willing to apply to a problem and what political will you're willing to apply to it. And the changes that need to be made are rather big and expensive. So I think the role of all of us and people like yourselves and me is saying that this matters. It matters for people's health, and it matters, for what we want our legislators to be prioritizing. And I don't know if it's a very satisfactory response, but I think lawyers matter too. So thank you for what you've done.
Well, I would just hope that Climate Code Blue could at least endorse the concept of banning the sale of internal combustion engines by 2030.
I'd be very happy to endorse that for sure. We endorse all kinds of things like that. So if you have something you want to refer me to, please be in touch.
No, just be in support of the concept. A lot of the climate groups are on that issue.
Yeah. I mean, one of the strategies we've been doing a lot of, I'll just share with you, is like we often work hard within our medical professional societies to get them to make public statements. So I'm a very active member of the Mass Medical Society now. I'm an active member of the Infectious Diseases Society, the American College of Physicians, American Medical Association. Those are the kinds of organizations that really have some weight when they endorse things. So thank you for bringing that to my attention. I think those types of groups are more heavy hitters, so to speak.
So we're over time, but we do have 2 questions left here. So I'll alert folks. We're going to continue after we let Dr. LaRocque go, because we've got a couple other things to cover. But so the next 2 in order are Tom and Grady.
I'll make it really quick. I just want to know, do zero emission non-electric vehicles still emit particulates? You know how they say some cars are zero emission, although they're gasoline powered cars?
You mean like the Volkswagen diesel?
Well, no, I
I'm not-
wasn't. There are others.
I'm not so familiar with what kind of car you're referring to. I guess all I know is that combustion of fossil fuels is really where the concern arises. So I'm not
Yeah.
sure how you have a zero emission vehicle that combusts fossil fuels.
Yeah, I mean, there are some that that's what they tout. They advertise that they are. And I was skeptical, so that's why I was asking. Okay.
Hydrogen vehicles.
Hydrogen vehicle, yeah.
Yeah, and that's in the future. Grady?
Yeah, this should be quick. Regina, in your excellent presentation, one of your slides mentioned a concept that I'm not familiar with, vector ecology.
Oh, sure. Sorry, I probably should have simplified my language. So a vector is an insect that spreads an infectious disease to a human. We call them vectors. We could just call them insects. But
Then you wouldn't get published.
exactly.
Okay. All right. Well, I think we're wrapping it up for Regina, right, Rick? And Regina, thank you again so much for making time available for a conversation with us. We will hear of you again soon, I'm sure, and you will hear again of us.
I certainly hope
Pretty
so.
soon.
It was such a great pleasure to
Okay.
be with all of you. Thank you for what you're doing.
Let us know how we can help.
Okay,
Yeah,
bye-bye.
stay in touch. Stay in touch. Peace. Bye-bye. Okay. So I'm
Okay,
going to turn it back over to you, Rick.
yeah, look, I've lost track of my own agenda here. Shoot, too many things open on my screen. That never happens to anybody else here, right?
No.
So we wanted to get a brief update from the legislative team because our work on the legislation continues. So I don't know who's speaking first.
I'm going to do that, Rick.
Okay,
Yep. Okay. So, the legislative team has several different irons in the fire, and I'll try to go through them reasonably quickly. I think most people are aware that the legislature did pass our roadmap bill, and the Senate passed a number of climate bills. And sadly, they're all still sitting in a conference committee where legislators are working on these bills. And we think ultimately a bill is likely to include elements of both the Senate and the House bill. The good news is that we hear from a number of sources that negotiations on the bill in the conference committee, although going very slowly, slower than we would like, are coming along okay, and that we should expect a bill to come to vote before the end of the session. Now, this session is going to end on January 5th, so time is running short, but we have some reassurance that we're headed in the right direction. A number of us met with Representative Moschino and other members of our Roadmap Coalition via Zoom a couple weeks ago, and she was very positive about a climate bill coming out this session. She said she checked in with Bob DeLeo, and she believed him and was reassured by him that we're headed in the right direction here. So hopefully this is going to happen. And thanks to everybody out there who's been reaching out to your reps and your senators to keep the pressure on the conference committee to move on climate. And we may yet ask you again to do that before this is all over. Hopefully not. Now, what's going to be included in that climate bill remains uncertain. These conference committee deliberations traditionally are kept under very tight wraps. Representative Moschino and others have no clue exactly what they're considering. Rep. Moschino has committed, if we don't find key elements of the roadmap bill coming out in the legislation, that she will resubmit those for the next session. So that may be something upcoming in our agenda, but it all depends on what we see coming out in that bill.
Roger, you just went silent.
Nope. Okay.
There you are.
But there we go. I think I'm on now, yes. So we're going to meet with Repiscino next week, and we'll keep you guys all updated on what's going on, for sure. Now, on another note, our legislative team is preparing for the release this month of there are two very important climate documents that are coming out of the Baker administration. I think some of you are quite familiar with these, others maybe not. One is the Baker Climate Roadmap Model. It's a technical report that'll be coming out in the next week or two. And the other is the 2030 Clean Energy and Climate Plan. Now, the roadmap report, it's going to be the result of modeling of several different possible pathways to get Massachusetts to net zero carbon emissions by 2050. Baker has committed to that goal, as do the various bills that are sitting in conference committee also. They're committing us to that goal. The modeling process, the good news, the modeling process that's being used is a backcasting type model, which the roadmap bill has called for as well. So we expect this to be a fairly robust modeling process with some good information about what we actually potentially need to do and what we can do to get to net zero by 2050. Now, this report should be out, like I said, in the next couple of weeks, and the Executive Office of Energy and Environment is going to be holding some informational sessions about the report. We'll let you all know when these are scheduled and how to attend if you're interested. The report is going to be issued in final form, probably way more than 300 pages with lots of appendices. There won't be any public input into this particular report, but there will be informational sessions. Now, turning to the Clean Energy and Climate Plan, however, also coming out before the end of December, not sure when exactly, it will be coming out in draft form. And so there's going to be a public comment period in January. So there's an opportunity for us to tell the Baker administration what we really think needs to be happening to get us to an emissions target in 2030 that makes sense in terms of where we're headed in 2050. That report is going to set that 2030 emissions target, and it's going to outline all of the various policies, the legislation that Baker thinks we need, and the regulations that we need in order to get to the 2030 emissions limit that they're going to be setting at that time. So our legislative team is going to be collaborating with some other members of our Roadmap Coalition on reviewing and critiquing this Baker Roadmap model and also the Clean Energy and Climate Plan. We're hopeful that our allies in the climate movement, a Roadmap Coalition and other folks, may come together to advocate for a genuinely progressive package of policies, legislation, and regulations on climate that will be included in this report and really push the Baker administration. So we're encouraging all of you guys to be engaged in any ways that work for you in this process of setting climate goals and objectives for 2030. Stay tuned for more information about the roadmap and the climate plan in the weeks to come. Look in the newsletter and the website and action alerts. Let us know if you're interested in being engaged with the work of the Legislative Committee on those issues. Next up, the legislative team and some others in ECA are supporting efforts by a number of organizations in Massachusetts, including 350 Mass and Youth Climate Action Coalition, advocating for some key rule changes at the beginning of the next legislative session that would make our legislative process much more transparent. Folks are probably aware we have one of the least transparent legislative processes in the entire country. People have been working for years to get rules changes, and it's coming up again. These rules changes would help make it clear how our legislators vote on legislation in committee and on the floor, and they would give legislators at least 72 hours to read a bill before they have to vote on it. Right now, things come out, 24 hours pass. There's little time to think about amendments or to have any kind of input whatsoever. So the 72-hour rule seems like a good one to me. There's more information on the transparency campaign on our website, and there may be a call for some advocacy work around this issue in early January, so stay tuned for this. Finally, on our agenda, we're tracking a couple of emerging proposals for new legislation in the 2021 session. The Mass Carbon Pricing Coalition is working on a bill to require and coordinate carbon pricing across the building and transportation sectors, among other things. the revenue from this would go to climate mitigation and adaptation efforts at the community level. So it's got some interesting ways of divvying up the revenue that might come from various carbon pricing initiatives. Another initiative put forward by 350 Mass is going to be a comprehensive housing bill, and we're tracking that very closely and very interested in possibly engaging with them in developing that bill. So as we get more information on these things, we'll pass this on to you all and try to keep you as informed as possible. And I'll ask my other members of the Legislative Committee if they have anything else to add to that. Arnie, BJ, and Tina, anything else on our agenda that we should let folks know about?
Oh, I think you covered it well. Roger,
Okay.
thank you.
Great.
Thank you, Roger.
And for those of you who just got all of that great information from Roger and your head spinning, remember that each week Seth puts out an action alert, which boils it all down to usually one or two things that you can act on. This past week, yesterday, I just put in a plug and a thank you to League of Women Voters. No, it was mainly Mothers Out Front for their excellent twittering instructions and the music. All I want for Christmas is a climate bill with teeth. I'll warn you, play the song and you won't get it out of your head for the rest of the day.
Okay.
But it was great instructions. It was a good thing to do.
Yeah.
So each week you get, sort of one thing to do at least, maybe two. So watch for that.